this because there are no new classes of antibiotics. We have to control the spread of resistance, and to do that we have to know what's going on, and that's the aim of this project basically. It is a really important project, and you mentioned I don't know if I'll stop. Just tell me when to stop. But you mentioned we're looking. The purpose of this visit this week is to look at the laboratories here, just to kind of look at the space and the equipment and the capacity and the training and the workforce capacity and all that sort of thing, and that needs to be built up. As Dr. Indar has already said, CARPHA has always done antibiotic resistant testing. Really, the only papers on Caribbean antibiotic resistance came from CARPHA a few years ago. So we'd like to boost that and get that up and running and developed a bit further for the future, for future resilience essentially.
So is it that we just waiting for this data? It's not there yet?
No, it's there. It's just we're not collecting the information. So part of all of what we're doing is building the capacity, and I'll let Dr. Cox talk about it more. But also, you have to build the capacity as well as collect the data. So we're doing a dual thing. So CARPHA's role, we have the regional remit. So we can be able to collect isolates here from the region, get the information, but at the same time, we're able to really work with our countries to share that data in a timely manner, and to be able to start analyzing that and to get that information out timely. As Matt said, you really need to know what type of resistant patterns you're dealing with.
Malaria is a vector-borne disease. They become infected with malaria. At times they self-medicate. And the type of medicines, we've done a study where the type of medicines at times are not very, they don't come through the formal sources, and so that can prove to be challenging. And it can contribute if person self-medicate in that type of informal setting to the emergence of resistance. This wouldn't be bacterial, but this would be more parasitic in nature because the malaria pathogen is a parasite. Now, having said that, as the colleagues were saying, there are different outcomes that we would want to consider. This is why we make the clamor. You asked the question of whether it exists or it doesn't exist. Is this something new that we're talking about, or is it something old that's been there but we're now picking it up? And the reality is that, as they've said eloquently, we don't have enough data to see the scope of it at the moment, especially for the Caribbean region, but we know that it's something that exists, and it's because of the threat of it expanding and beyond our control and the possible ramifications that we're particularly concerned, and we're coming as a partnership.
That's part of this project, public health education and medical education too.
Yeah, and that would go in tandem as we do all of this. The whole revamping is to really, as you said, what your sister said, and it's the same thing. I mean, for instance, as a young child, my brother always was getting into some falls and having cuts and so on. But every time he goes to the doctor, you give him antibiotics. Well, you probably could have just put something on the wound, right? But then later on, when he really needed antibiotics, of course, he would have developed, there would have been antibiotic resistance developed.
So I think in a nutshell, what you can say is that AMR actually develops in a population of microorganisms. And that's in the individual. So when the individual, for example, gets sick and takes medicine, some of the bacteria tend to be killed off. But then some become resistant due to mutation. They become resistant. And then it can spread from one person to another. And then it can be spread through environmental factors as well.
Before it has moved into the UKHSA, it was Public Health England. And CARPHA already had, CARPHA works with through partnerships. And we have had a long-standing relationship with Public Health England when they changed into UKHSA. And it's not just for antimicrobial resistance, it's for overall prevention and improving public health. So we have an MOU with AMR, with the UKHSA that speaks to infectious disease, building capacity, training, vector-borne tourism and health and so on, as well as AMR. But in particular for the AMR, this is near and dear, not just us, but because of the vested interest of UKHSA and the Fleming Grant, which Matt will speak about a bit more. But it really, we know it's an issue, we know it's a global issue, and it's also near and dear to them. So working with them really kind of solidifies that, and it solidifies the importance of it to the region as well, knowing that this partnership, which is also a global priority, which is also a priority in the UK, to help us solve these issues. So we are working not just with UKHSA, but other partners, but primarily with the UKHSA.
Yeah. So we're the partners delivering this project, really, but as Lisa has pointed out, a lot of the funding has come from the Fleming Fund. Mm-hmm. The Fleming Fund was named after Sir Alexander Fleming, who was the discoverer of penicillin, and it's so that's pretty appropriate. But it's a UK sort of aid programme supported by funding from the UN and WHO as well as the UK government, I believe, and it works with I think over 30 countries now across the globe. So this is the first sort of movement into the Caribbean region for the fund, I think.
Really?
I think we're pretty sure that's the case.
So it's a first.
So it's a really great initiative, and the aim of the Fleming Fund is really to do exactly what we've been talking about, to help countries develop their surveillance, their public health education, and the responsible use of antibiotics. And so to do any of that, you've got to know what's going on, obviously, in the region in terms of the bugs. So that's why we're starting with the lab programme and getting isolates from all the Caribbean member states to look at the current situation. So a lot of the funding has come from the Fleming Fund, probably the Pandemic Fund as well, I guess. And we, CARPHA and UKHSA, are the kind of delivery organisations, and we're working closely together to get the project up and running.
Mm-hmm. And there's always that constant talk. How do they strengthen? They have gotten us, linked us up to the Global Health Outbreak Network and so on. So it's not about just investing and saying just a project, but really, building that technical capacity for strengthening and improving, health in the region. And so I think the partnership is here to stay. And
as well as the real laboratory expert John Lee, who you met earlier on, who's working in the lab at the moment. We're hoping to have more secondments from UKHSA and that on the technical side. But also next week there's an expert colleague coming who's an expert in epidemiology and surveillance, and she's going to be looking at the setup here and how we can start bringing that data into a regular surveillance program.
And when it comes to the routine, we will always have monthly meetings, partnerships meeting, EMR, Pandemic Fund Project meetings and others. So we have systems in place that allows for that. But of course, again, the proof is in the pudding, right? We're going to keep at it.
And one last thing I noticed in the brief, it was speaking about stages. So I wanted to clarify that, the stages of the project. So if you could just give an idea of.
So phase one, which is this financial year, in other words, the end of March, we've been instructed by the UK government that this is procurement, the procurement year. So that's why we've listed all the required equipment, the procurement process has started, and we aim to have that all in place in this financial year. Initially they said there was no funding for training this financial year, but we've actually already started that. We're here in person doing that. And so the second phase involves developing the workforce capacity, the training capacity, and the skills capacity.
And this is the value of partnerships and even with the Pandemic Fund grant. So the training and some of the travel next week is UKHSA Pandemic Fund. When we go out to countries, we'll be using that, but we're using the Fleming grant to get the equipment. So we are combining it for the overall impact.
So 2 phases, basically.
Yeah.
So you say by the end of this financial year, we get in monthly reports.
No, the equipment will be in place, and we'll be starting to implement it. Dr. Nathaniel and I have been working this morning on getting guidance out to all the Caribbean member states on what to send. So we're working hard on, again, engaging all the Caribbean member states so we can start taking that now. And obviously you need bacterial isolates to get the data. So we've got some already, in the ones that are referred routinely. But we want to encourage each member state to send us isolates on a monthly basis, so we've got a continuous stream of information.
And for our non-technical people, isolates is reports.
Bugs, germs.
Germs.
Yeah,
okay.
actual germs. So they're going to send the actual germs. But if you think about it, they've
And
got
in a safe environment. And it's very safe and non-infectious. Let's say
one of
that.
the big challenges in the region is the transport logistics. To try and get, germs in a box from Cayman to Trinidad is a bit of a challenge, which is why we're using the CARPHA regional labs in Jamaica and St. Lucia as hubs for these as well.
We have very safe transport. Nothing is infectious that's being transferred. You have equipment and, you know,
There's very strict regulations
yeah,
out
and
there.
strict
around, you know.
regulations that comes, and even if something spills within that container, it's contained.
Yeah,
So,
yeah.
but you
Yes.
need to, yeah, I mean,
Yeah.
I'll ask Sue to talk a little bit more. But you spoke about, you know, to get at this isolates and to get the information, we will send out some information, and on the week of the 20th, we are having a meeting with our chief medical officers, our lab directors, our national epidemiologists and so on, to kind of say, well, you know, this is where we're moving, not just with AMR, but for AMR, we're going to say, this is the reasoning and what we want from you, and together with the information we are sending out as well. So we always have more than one ways, but to advocate at the highest level, and you know, you're advocating for us, you know, as well, and others to talk about, look, there is a problem, we need to solve it to better improve health. Having the Fleming funding come to really add to that, really kind of, you know, adds more money that we need to really strengthen capacity for the region, and we are literally going straight into it by first strengthening our regional capacity, strengthening the capacity in all our 3 regional labs, starting here, so that we're able to test, and so countries can send isolates, even while they build their capacity, they can send. Right. So as Dr. Cox says, I mean, the outcomes can be divided into 3, as or maybe more than that, but you know, you want to build a surveillance capacity. It gets you to get the data, know what's happening, and that information we want to provide to our countries and to the region very quickly so that they can do proper intervention. You know, if you have one misuse of antibiotic, if you have high resistance, so physicians will know, well, look, how to better treat, and animal population or the veterinarians can know, well, okay, reduce on this and so on. That's one. But there's the building capacity to rapidly test, and then you strengthen through the training the workforce capacity. So we hope, you know, and our targets, I mean, CARPHA has its work plan, and we hope by the end of the year we're able to start getting data. And we hope in 2 years that we're able to really have our act together in terms of all 3 of our laboratories able to be the center of excellence for the region. 3 regional hubs where we have that offering of service in terms of antimicrobial, as well as other testing, because the machines can test for the range of pathogens. You first have to identify the pathogen before you're able to say, well, okay, what type of antibiotics is resistant.
Yeah.
So we're able to build the capacity. While that is happening, countries are also building capacity. And we spoke about partnerships, and PAHO, the Pan American Health Organization, is also working in this field, and we're also partnering with them. They are also partly funded by the Fleming Grant, and their goal is to strengthen the country capacity. So between PAHO, CARPHA, and UKHSA, the country's capacity is strengthened, the regional capacity is strengthened, you have the data coming in timely, hopefully, and so therefore you have better intervention, and the overall outcome is, you know, better health.
So we would like you to use your voice in channeling the right message, and as the team mentioned, we have the documented well in the brief. So perhaps if you could be equipped with it and just channel the right message to persons and direct them to the right sources, because we are cognizant, especially after COVID-19, about the epidemic and what can possibly result from that. So if you can help in terms of channeling the right message, we'd appreciate it.